Good afternoon all. We want to welcome now all to the medical discussion over medical topics. This particular program therefore focus for tell you about certain disease and way they affect you in our community. And we get for bring well body people and we therefore can help we understand some of these topics them here and some of them disease conditions them, how we go able to take the right measures, the right treatment towards them disease there. And we also therefore focus on clearing some of these misconceptions on them particular disease there. So on today's video, I deal with one of clinical students from the School of Clinical Science, and he is David Sise. Welcome, sir.
Good morning to everyone. Me now my brother winner David Sise. I deal today for can't talk about sickness will be say we don't deal about most of we brother with sisters, mama them na sorry. Okay. So today we can talk about one sickness called HIV this morning. So hope you are very listening to me and also whilst we share the message.
So thank you very much, David Sise. So we can start. So we want to know, we want to know, what are this HIV and what are this AIDS? So how you will explain to Fambula and for let them know what are HIV and AIDS?
And for let people I'm able to know the differences important. Okay, one thing is people need to know HIV. Okay, we normally can cause a virus we call a human immunodeficiency virus. Where normally this virus can cause the infection. Okay, so what in this virus they do? It go attack the immune cells we call the soldier man in our body. It cause massive destruction of parts of most of them soldier man there. So it will make now the body then and the follow will resist or fight all that type of sickness, and now it will be very challenging. Okay, so that will make the body then and enable fight the disease to the way they fought them before. So the final then now the person immune system don't begin to drop gradually. Okay, and of course in AIDS now, it's what we call acquired immunodeficiency syndrome. Of course, at that stage now, wherein the person already gets sick, okay, in which this HIV they go into the latent stage we call the last stage, okay. In that time now, there will be a massive destruction of parts of these immune cells, okay, we call the soldier man in our body. So anything in the body prone to most of them infection like TB, that of pneumonia, okay, and even most of them other cancers. Okay. Yeah. So then also the body entering because the body will become decompromised or be say don't weak in a way that enable fight all the type of sickness then they get to the time before.
So is there any time, you get any particular time where in this particular virus we don't enter this body, till it go destroy these immune cells them, and till that person go in that position where in small infections then go they bring them down? Is there any time range before the manifestation of them things they are?
Yeah, so on the HIV, initially the symptoms and hardly follow the person begin experiencing, okay? Because within that time a destruction where they happen inside, and it hardly follow the body able to give a response, okay, meaning they begin to experience the symptoms. So there are research where still say the thing today at the system, okay, for 5 to 6 years before we begin any presentation of any symptom, okay. In a situation wherein it begin to present the symptoms now and like in the age of like 6 to 10 years, okay. In some people them still know they become more the symptoms now they become more manifested, but they enter in the peak wherein it starts for any sign of symptoms. Okay.
So yeah, so Boss David, we want to know what are some of the roots or the way this HIV they become transmitted, because people then get the belief say this HIV this sickness they only become transmitted in people who they get actively the sex, more especially people who do that prostitution business outside there. And also people then get the belief say back when one don't get HIV, they for balance them because they know they able to deal with them because they see when they church them they get the disease or they eat with them they will get the disease. So we want to know how this HIV it become transmitted and what are some of the risk factors. What are some of the risk factors they are wearing if they expose themselves they will get higher chance to get this HIV.
Okay, thank you very much, Mr. Andrew. And if we move on to the transmission, okay, the transmission we categorize them in different aspects. Okay. One is we get sexual transmission. Okay, where the highest risk of getting HIV. Okay, and especially like the one that we do, be it vaginal sex or be it anal sex, where like the one that we sex through the anus or the one that way they get directly from the vagina, or maybe the one that way they sex where you do that oral sex also, from the mouth. And all of them people in the all that they category they expose the transmission also. Okay, in the aspects of our sex. Okay, so if we move on the other transmission, okay, in the aspects of like blood and that of blood products, okay, or fluid, okay. The blood inside is more common in an area like people them way normally can get any contact with also we say we get HIV we would, okay, like also get HIV, okay, then you back get wood you go come in contact with what within blood, okay, so then they expose you also to the risk of contacting the HIV, okay. And another one also is in also common, okay, like in a hospital setting, because why make it also common is because in terms of transfusion, okay, before they give any blood to person, make sure say the person will thoroughly screen. So in the chances of unvolate transfer is very low, okay? Not so common because medical practitioner there will be say they know what they do and they always do the right thing, or let them know say the problem not will happen to the patients, okay? And also in the area also is it also they happen in like in the case of like the one that will be say we can sharing sharps, okay, like if a person like the medical practitioners, okay, like then IV drug users, okay, you understand, like if this person HIV victim, okay, for example, like you don't administer medication, you not change that syringe deal, but you go use a back for draw IV drugs or EG, so these are all they expose the other opponents for like the disease become contacted, okay. So I think these are the things.
Okay, so where they outside there we believe say HIV they be transmitted via mosquito bite or when you hug person or when you eat to the person. No, mostly this HIV virus they become transmitted via through this blood contact, and we already listened to what Professor Dave say as per the sexual transmission, as per the using of them sharps them like needle, comb, where they barb in the street, where they don't use this instruments for barb, then we use them back on you. There are certain things that we can left. So all those signs are where this HIV they become transmitted.
So we move on forward on the transmission where people still believe, and of course, and comb or be it like babbing machine where people use daily activities. Of course, it can only become transmitted like in aspect of machine because the comb, the virus normally no can stay outside the surface, okay. So for the virus will become transmitted unless the place therefore be moist, okay. For example, like if the person, okay, the person will get the virus, okay, like a rumba newly, you understand, that person no disinfect that machine, then you know it will take back it bab another person, okay. So it impose a risk of transmission to that particular person, okay. But we can always advise you the sooner you don't bab disinfectant, clean them, figure and change them for like this for some time, okay, because hence the virus don't become exposed in a surface, there are less chances for the virus to live, okay. So and the sharing of utensils also, okay, people believe like sharing of a cup, okay, or plates, okay, with person OBC will get the victim. Of course, then meat OBC not to not just a misconception, but yes, so scientifically proven. We say all landed the transfer because just like what I don't say, the virus will exist in the surface environment will be safe, and if you don't exist wearing a place will be say we moist, where in fluid or they safe. Okay, so these are the most commonest means of transmission.
Okay, thank you very much. As we don't clear the path for the transmission, now we want to know, because seeing the fact that this particular virus, they take about 10 years before it manifests any symptoms or any thing where they tell person I don't get this particular HIV. So what would be your advice concerning this particular aspect?
Well, the advice we get for the people is, and one thing is, you find for you go to do a medical checkup. Okay, so be it the other infect or the other expose, okay, or the other say no expose it, okay, or the be in a safer side. Okay, of course, when you go to the health facility, okay, you go say one of your status. I think that would be the most appropriate and it would be the most safer side. Okay, of course, when you go there, of course, when you go draw blood, okay, do some tests or check. Will be say, but there are some tests that they will be say we will tell you the early detection of the virus. Okay, so then they will be say they within from the 10 to the 33. Okay, but we go to hospital, you know, Mr. But we go to hospital, then go do them test and for you, then go do yourself, and also then we do test also for no that type of soldier man there. If you're not weak in your system, they all day within them test and all the type of yourself. Understand? So if the person not able to do that, not able to take action for going to health facility for able do some findings for the health status, I think that they continue for make one. It will continue for spread the disease. Okay, it expose more to the one that maybe say we don't get it, specifically for the one that we don't get. Okay, and also if he go do test earlier, then they also go to help you. Since they don't detect them for you, then they will put on the medication straight away. They will prevent for complication. You know, therefore they again as time goes on. Okay, and also is it also the help in terms of what for the one the way you on medication. Okay, it will help you for later. It will advise you for you stick on what on the medications, because the medication I need to medication will be for cut off, hence you don't start them, because the medication what it will do, it will suppress this virus. So the sooner you left or take the medication, so what it happen, the virus still multiply itself again. Okay, so there are high chances back for the routine for you transfer the disease. Okay, so now make in early for go to the clinic or hospital more advisable. Okay, for being in a safer side, and also for reduce the transmission, and also for prevent more further complications in terms of this disease.
Thank you very much. So Boss David, we want to know, because since HIV na a lifetime treatment, we want to know if by any means person stop for taking the medicine, what thing will happen, and also what are some of the stigma or the related ideas where people get outside here for HIV. So, and how will you able to control that? Because if you look at in a case wherein a person will get this HIV right from the third born, but you not gonna know, and you go down they take onto marriage life, then they tell you don't marry now, you can't find out say, and couple can't find out say you get HIV. So in that particular case, what thing you feel say will be the best advice for those people, and what thing you go feel say you go suggest will be done onto people who will not get it this idea.
Okay, so thank you once again, Mr. Andrew. And just like what I say, of course, the essence of the medication is for this medicine will suppress the virus. Okay, now the key main priority of the medication. Okay, so as the virus becomes suppressed, so then in the body back, we will return in normal position back. Will be see will be the first disease than before. Okay, but you will be say start the medication, or you start the medication become default. Okay, there are high chances for let this virus multiply again if we keep the immune system back. Okay, and also is for the one that we don't start it on the medication. Okay, and you find out say there is a high chances also for let them increase the viral load. Okay, so we be say that it also will be challenging for you where if you not prompt them earlier, the time you go take the medication is too late. Okay, and also if we can in terms of the stigma, okay, of course alone the key main challenges right now we majority of them people may face. Okay, and one of the stigma is people may take and they take and say like sharing of utensils. Okay, like casual contacting. Okay, like in the case of for shake hands. Okay, or hugging. You understand? Or playing together, eating together. Things say all these they transfer the HIV. You understand? So this can find a great challenging in terms of whether people are belong to the society. You understand? So this we can advise for say all this misconception, like in the aspect of like that casual contacting. Okay, HIV no they transfer. Okay, HIV no they transfer. Hence that person they no wound. You understand? And you back no get no wound. We be say we will play with him blood all them will seven. Okay, like in the utensil size that same thing able transfer. Okay,
all person.
Yes, that's able hug, able self sit down together and make fun. All them will seven. And for the in the aspect of the one that will be say where you don't get the virus during the time where them born them. Okay, will be say normally it can be due to the time where and they start forgetting that we call the conception stage. And also the time will be say where then they born during the labor stage, and also maybe due to maybe the time will be say then they born during breastfeeding. Okay, so in this aspect, so we always we can advise or say before couples then decide for settle go do medical checkup, now do na status first.
Sure.
Okay, I think that would be a guide that will help you for let your partner una will be in living peace.
Yes.
And also then they also will be you correct for say, oh, I trust this my partner we adult. You understand? I think that would be the most helpful aspect will be saying if the people follow this thing where they talk, I think that would be a great change.
And
the
also
will be reduced.
And also people maybe one way or another person will become defaultant, you know, go do this screening. You understand? But yet still after you can find out say maybe a woman get HIV. But look at another way, say this woman they cheat or you get other person outside there. So this thing already happened as inside the marriage. What you go say you go advise them people for let them do. For let's say this disease because it often affects the psychological part of the woman first. The woman will be mentally disturbed.
Exactly.
What I do? I not get any interference with any man. How this disease can not go no say it's a right for where they don't born. So what you go advise as per that particular case?
Okay, so one thing is thank God and the ministry don't they work hard in terms of that. Okay, there are people who be say where they handle them thing. Okay, people where they waiting for counseling. Okay, like if you can't detect later or say your partner gets HIV because until we be say you become so patient with depression. You understand? It's so emotional. You understand? So for any person break that challenge there. It will be very tedious. You understand? So we can advise as partners. Okay, then make always the place open in any government facility. Always then get the office. We'll be saying go and talk to them. At least they will not there on the medication.
Yeah.
At least because if you're not on the medication, there is high tendency for Leona. There is a prolong of its existence. Okay, so then make always we can advise. If this happen, we later on we find out. So this will be a greater challenge. We'll be say. We for go through, maybe say it will be helpful now to live a happy family.
So family, just like what Boss David say, this particular thing here, we need for no say HIV mostly they become transmitted via sex, and not just sex, as via where we get wounds them, where blood exchange or fluids don't become exchange. So you know they become transmitted through the mosquito bite, or for say we hug person, or for say we play with this person we get HIV. No. They become transmitted. So we advise people outside there for they will get this idea say if HIV not to a death sentence. For say when this person don't get HIV, we not for interact with her or not for play with her. No. HIV people or HIV victims now just like me and you, just that it be unfortunate for them, they don't become down with this virus. So we advise there with the 10 for we send this message. But let people able know and able draw people in closer way become affected with HIV, because one way or another if we say we stigmatize them psychologically, mentally they become unstable.
Exactly.
And that one will also affect them because we continue for stress. We are in the body way for fight against the soldier man, they don't become weak and they don't be for stress back. Now a whole case back, a whole complication. Exactly. So the best thing where you need for do for every HIV patient there, any HIV victim, for let's say you draw them, give them that psychological support, palliative care, and also support them. Exactly. So now this we bring to now. So Professor Dave, a quick one before we go. What will be your advice for people where they outside here?
Well, the advice is strictly we go to the ongoing school pupils, okay, and of course in terms of information, always make sure say you get accurate information.
Okay,
that's the thing.
Yeah.
Okay, and also make sure say a judge person. Okay.
Yeah.
You know a judge person, because that judge way the judge, you know how person get the disease. You understand? You know get the real facts of the source of that means of transmission.
Sure.
I think that would be a great stigma also. Maybe say people maybe the gossip, say this that.
So,
obviously the most self of in our society. Okay, and also is what we advise also is when I think there is a need also for the schools. Okay, what we call the preschool base school education, for able to educate ongoing school people there. Okay, in terms of safe practice sex. Okay, and how for do protection in terms of this type of disease. Okay, and also if we look into aspects of the couples, okay, the couples also we can always advise you for say waiting before you go in for a woman or a man, make sure say do medical checkup. Okay, visit the hospital. Now always go for medical checkup, and even though now we say don't married, always do medical checkup if necessary. Apart from HIV, okay, there are other diseases that will be say then we find out. Will be say we will understand. Later on it don't become
a
problem for you. Okay, so down the back also we can also advise. Okay, so of course in the religious aspect is, of course, you see this HIV, the stigma where most of the religious aspects and all of the cultural aspects in the service, you can say anybody will get this HIV, okay, now due to sexual activities, the commercial sex workers, okay, and normally get exposed. Yeah, that's it exactly. And also like the way they use the abuse drug users, okay, the way they take drugs, okay, and also like the prisoners. You understand? So meaning then can people and they find it very challenging for let them mingle with the public, okay. So due to that, so we can always advise the community, at least for let we show them people and let we advise them. If you study the process, if you call them, it's still educator. Okay, now this you don't be hot. Take courage. So what did you do now? Stick on the medication. Understand? That encouragement.
Sure.
Yes, need them. Okay, Lord, not just push them far away. Okay, they are all humans. Okay, there are circumstances or mistake coming. Obviously, individual become contacted. Okay, so there is a need for let we all encourage them, for let them stick on the medication, and for the one that don't know affected, they always advise as each and everyone always go for screening for all those 7, and also there be a nutritional support because the body don't weak. Yeah. Okay, and need for let you eat fine. You understand? For let the body able to build up the cells at least. They continue for the normal daily activities. Okay, so thank you very much.
Thank you very much, sir. So Fambul, wanna thank you for listening. Today with Boss David, we were not able to cover certain things them under HIV. We don't know what are the different transmission of how this virus can be transmitted. We don't look at the different stigma. We don't look at why it's important for do this testing. We don't look at why it's important also for the person they on the drugs continually. So I want to send this message out that this particular show they bring out to now for CC we educate the public, we educate people outside here, and also under this channel we get for they bring clinical medicine. That one this now that particular show they get for base for medical people. People who they study medicine like nurses, CHOs, and also clinical officers and doctors as well. So therefore they get health people, health workers, the model for come in for tell we about certain disease condition. So therefore they teach the masses, they teach the community, and also get for the teach ourselves as a healthcare worker. So we bring this program to you today. Me and Mosire, I happen to be the host, and today I'll be happily there with the guest. We are David CC. So thank you very much, sir.
Yeah, so we fumble them as a summary on what you know, what you don't learn. And of course, this program normally a educative program because we want people more than they outside for them to understand. Okay, so now we could make an increase. And just like what my boss don't say, of course, we got a clinical aspect, meaning the one the way they do medicine. That's how you will be so. As time goes on, then we therefore will talk on that. So the message where I just want the public is, you know, HIV just like what I don't talk. Normally, viral infection, where it can be very challenging. It can make the body immune system is so weak in a way that they produce all sorts of infection and diseases. Okay, and also is the transmission. Don't forget the transmission, how this thing they transfer. Okay, because if you prevent the transmission, I think there is a big chain of this HIV for it not continue for spread. Okay, and also is the adherence of the medication. Okay, we also they advise the public. Okay, the one they will be say we don't on medication, at least for that they will stick on the medication. They not default on the medication, because the default then the still the disease they progress to more worse stage. Okay, and also is the advice for the ongoing school pupils. Okay, and of course these means what we do for educate. Also, I think these are other means for we spread the message. At least we'll do this digital social education, and also like do school-based education. Okay, I think these are the means will be say, like for the picking them will be saying a small picking them, then also picking them. I think we can put story for them also. Yeah, Mr. Andrew.
Sure. Yeah. So thank you very much for watching. We don't come to the end of this program, and that I encourage we all as we watch, we will learn for the share, like, bring comments, and then also subscribe, because now this the able movie as we bring onto these numerous medical topics them and different ideas and different knowledge. So do like, do subscribe, and do share for more. Thank you very much.
So please subscribe.